All right. Again, welcome. Um, my name is Dwayne Parker. I'm with Associated Ministries. And again, we want to welcome you guys to the meeting this week. Um, First and foremost, we want to ask you guys if there's any new people joining this week, if they want to introduce themselves. Oh, first and foremost, we need to do our community norms. We want to make sure that we lead with racial equity lens. I am having a hard time talking this morning. I apologize for that. We want to be aware of our power dynamics, challenge concepts, not people today. Listen to learn, and we also want to make sure that one person is speaking at a time. And if you are speaking, please speak from your own experience. And again, make space for others and take space when you need to. Assume the best intentions and take responsibility for impact that you cause with a statement, if you have any. And be aware of the time and agenda because we want to make sure that we get everybody through this morning. Okay. All right. Also, with the Zoom norms, we want to make sure you mute yourselves when you're not talking. And if you need to uh, make a comment or want to talk to us, please raise your hand. It's a small feature down at the bottom with reactions. You just hit that button and it'll pop up, and you can raise your hand or do a clap or whatever you'd like to do. All right. And if you are dealing with stuff going on, because I know we are all at work and we have clients coming in, please, if you have to take care of something, limit distractions by muting yourselves and also making sure that your camera is off if you're dealing with stuff so that we don't have a bunch of different things going on behind the background. That would be appreciated. All right. So, with that being said, let us go ahead and ask new people joining us to introduce themselves. If you are new and you would like to introduce yourself, just unmute yourself and go for it.
I can start. My name is Kiani, and I am a coordinated entry case manager here at CCS, the shelter side. So, yep.
Good morning, Kiani. Welcome to the meeting. Appreciate you. All right. Anyone else?
Hi, my name's Sarah McKinney. I'm joining you guys from the Tacoma Rescue Mission. I work in the Community Engagement and Development Department.
Good morning, Sarah. Thank you for joining us this morning.
Thank you.
My name is Rachel McHugh. I'm with Sound Outreach. This is my second meeting attendance.
Oh, welcome, Sarah. Appreciate you coming in this morning. Thank you. And I should note, I probably stepped all over Rosemary's introduction this morning. I totally apologize about that, Rosemary.
No, it was perfect, Dwayne. It was great. Thank you very much. And I think Rose was about to say something. So,
Okay. Rose, did you want to introduce yourself? Or?
here I'm putting you on the spot. Didn't mean to, but I saw you beginning to. So, welcome.
Me? Is there another Rose?
I think it's you.
Nope.
Oh, okay. I'm Rose from Ideal Option. I'm the lead community outreach coordinator, and we do Suboxone, buprenorphine, Vivitrol, naltrexone, treat opioids, meth, and alcohol. And supposedly I'm going to be talking a little bit more about that later. Rob's nodding. Okay, cool. Hello, everyone.
Good morning, Rose. Thank you for joining us. Look forward to hearing from you a little later in the meeting. All righty.
I think I was on mute. My name is Rachel McHugh, and I'm with Sound Outreach, and this is my second meeting attendance.
Thank you for showing up this morning, Rachel. Good to hear from you. All right. Is there anyone else that would like to introduce themselves?
Yeah, good morning. My name is Dion Lister, and I'm a career project coordinator with Career Team.
Good morning, Dion. Welcome to the meeting.
Good morning. Thank you.
Just leave a little space for anyone else. All right. That's good. Okay. Thank you guys for joining us this morning. And also thank you for introducing yourselves. Again, it's a pleasure to have you here. Appreciate you. All right. So now we shall move to this week on the streets. Are there any updates? Mm. So the streets are doing well this week, obviously.
I just want to give a little shout out to the water situation. It is much better this time around, and I think we can lay a lot of that at the feet of Maureen Howard. And also, all of the other folks who really, I'm not going to start naming them because I'll leave somebody out, but there was a team of people who really pushed hard on this, and it's much easier this time around to get water out. We were able to get it really quickly yesterday, and thank you, Jeffrey, for bringing some to our porch. Anyway, people have been really appreciating the water, and I really appreciate the ability to pass it on.
Thank you, Teresa. Yes, it is great that we have moved from a place of reactionary actions to proactive actions, and I do believe that is a lot to do with the way that the people in this group, handled the situation last time. So again, give yourselves a good round of applause for being there for the people. Thank you. Are there any other things that we have from this week on the streets? Thank you, Teresa, for breaking that silence.
Looks like Monique has her hand up as well.
Oh, I am sorry. I can't see hand ups. Go ahead, Monique.
I actually just took it down because Teresa mentioned I was going to talk about the water. We're going again this morning to pick up more water and take it out. And I was going to say it's been much easier this time. So that was it.
Thank you.
Jeffrey has his hand up.
Jeffrey.
Hello. Yeah, the water situation is much, much better. I did have one encampment that was kind of really hurting for it, and got some out to them. So it's way out in the south end, that's all I'll say.
Thank you, Jeffrey. Appreciate that. Does anybody else have any ideas about any new encampments, or have they heard of any new encampments that they'd like to share before we move on? All right, Jeffrey has his hand up.
Yeah, is Food Not Bombs here by any chance this Friday? And there are couple of encampments that are developing out in the south end. That's as far as I'll tell you right now. I did see an interaction going on with a camper in a park and a police officer that I thought was pretty rude. But it's let's just say that I'm starting to see movement to the south end right now.
Thank you for that. And so we know where to keep our eyes open for helping folks. Monique.
Yeah, I just had a question. There's an encampment that has gotten bigger over by, I think I want to call that Pilot gas station over by the Emerald Queen on the side of the freeway. Is that a newer encampment, or has that been there a long time? No, just growing. Okay.
Is that the Pilot Camp?
Yeah, that's Pilot Camp.
Yeah.
Oh, is that what you call Pilot Camp? Okay, yeah. I just
Pilot
noticed
Camp.
getting bigger, and I didn't know if that was new or not. Okay, thank you.
No problem. Thank you. All righty. So at this point in time, we're going to move on unless anyone else has anything that they would like to share before we move to our next segment. All right, wanted to make sure. All right, let us move to our next segment. And I am going to ask Rose to bless us with her last name so I don't destroy it.
Thanks,
Could you
Dwayne.
introduce yourself? Thank you.
Rose Simotiuk, but feel free to call me Rose. Yeah, hi everyone. We just opened a clinic in Puyallup, and I work for Ideal Option. A little bit of background about us is that we were started in 2012 by ER doctors, and we still have a lot of doctors, nurse practitioner, nurses in our leadership. We're very passionate about stopping the cycle of ER, jail, back on the streets, over and over and over and over again when there's a really good solution, which is Suboxone buprenorphine or Vivitrol naltrexone, along with a very strong support system, whether that's counseling or groups or a peer. And we have 2 mandates. We were actually invested in by Blue Cross Blue Shield Ventures. So the first one is that we promise to rapidly induce people on medication. They don't have to wait a week because that's ridiculous anyways, right? Right now we are short-staffed like every healthcare organization, so there might be a wait time, but if somebody comes to the clinic before, say, 4 p.m., we will get them their prescription for medication same day. The other thing is that we are passionate about serving people with Medicaid, because there's so many places where there's cash only clinics, and that doesn't work for a lot of people at all. And I'm sure you all know that when you find somebody who's homeless, the first step is to get them Medicaid, and then we can rock and roll, right? with them. So yeah, our only brick and mortar clinic in Pierce County right now is in Puyallup. So it's on Meridian, up the hill from the hospital in sort of a nondescript area. But if you're driving up towards the shopping center and look to the right, you'll see our sign there. And we're open Mondays through Thursdays, 7:30 to 6. And I'll put my information in the chat as well. But I live not super far. I've always wanted to move closer into Tacoma, and I always get kind of conflicting messages on whether there is a need for same day BUP for essentially like a large homeless population or Medicaid population. So feel free to message me, email me if you have any spots where you're like, yes, this is perfect. We're also exploring ways to be on site at places. So we're up at Compass Day Center in Seattle, in some court buildings and some mental health sites as well. So we can better meet people where they're at and not make them come to an extra step to come see us at the clinic. So yeah, and we do opioids, meth, and alcohol. We can even do a alcohol withdrawal protocol as long as people don't die when they stop drinking. We can set them up with medication and daily phone telehealth visits to guide them to, we say, reduce drinking. We have a harm reduction model, so of course we want them to stop, but yeah, any questions? That was a lot for 9 a.m.
That's great. Thank you, Rose. Yes, are there any questions for this morning?
I see Maureen.
Yeah, thanks. So can you literally go out to the encampment?
We can. It's hard because our insurance and everything requires us to do a UA, which is not punitive. We don't care what's in it. So that's kind of like the tough part. And then having telehealth, that's my dream though. We're working on oral swabs, so that'll be a lot faster. And having somebody go out with iPad or phone and just giving people their appointment right there. We've gotten pretty close.
So is it a funding issue?
It's a funding issue and a logistical issue of I mean, I know people would just go and pee behind a bush and give us a urine, but it's a lot easier if we can do oral swabs. So it's supposed to be next week that we're launching those oral swabs, just primarily for those reasons. I mean, other companies have it, but we have our own laboratory system. So our lab guys are just poking and prodding, making sure it's perfect. Yeah, that is my dream for sure. And I already go out, but I'll grab somebody and bring them to a clinic or a nearby spot.
Thank you.
Teresa's got her hand up.
Yeah.
So thank you for coming. It's great to have somebody who's around Puyallup coming in. Sometimes we get pretty Tacoma-centric, but I'm going to ask you a Tacoma-centric question,
Sure.
which is, if there were an agency that was willing to host you doing this in city proper in Tacoma, so Puyallup's proper too, doing that in Tacoma, would you, what kind of space would you need? What kind of, and it sounds like you're doing that with other agencies. What does that look like?
Right. A room that can be as small as a closet, as long as we can get 2 people in there, and have as much privacy as possible around HIPAA, and a bathroom. And that's about, and we want to be ADA compliant too, for people. And that's about it. Yeah. So definitely reach out to me.
Sally has her hand up too.
Rose, could you talk just a little bit about the services for people who are dealing with meth as their addiction?
Definitely. So there was a study in New England Journal of Medicine that did Wellbutrin, bupropion, and naltrexone, Vivitrol, the oral together. It wasn't as good as buprenorphine, which has about 50% long-term success rate. It was about 20% of people, but they responded, I mean, instantly. They actually have packaged it now together as a weight loss medication too, because essentially it stops your cravings for things completely. And it's been used for smoking for a long time as well. So I always, and the side effects are minimal. It's not like Suboxone, you can stop anytime. So I always saying like, hey, if this is a wall you've hit, like, let's try this. It might not work. You might not be the 20%, but let's give it a shot. And then internally, we do a lot of data collection. So especially if it's not their primary drug of choice, if they're using opioids and meth, we just see the meth use reduce within a year. People don't stop both abruptly in my experience, but just coming in to see people, talking, connecting with a support system seems to help a lot with the meth use as well.
Thank you. That sounds really hopeful.
Yeah.
I kind of had a question, Rose. As a case manager, what is the best way to link up with you guys, as far as how would you like us to reach out to you so it doesn't get overwhelming?
Sure, I'll put my email and phone number in the chat, and I can also make a post in the mailing list as well with all my information.
Okay, thank you.
Overwhelm me, please.
Any other questions for Rose? And I can't see hands, so please unmute yourself.
You're good right now.
All right. Thank you, Rose. We appreciate you coming in. We want to give you a hand of applause. I appreciate that. And we'll definitely be staying in contact with you. Looking forward to getting your information. All righty. All right. So with that, let's move to our next piece, which is context and timeline of the effort to end street homelessness by November 1st. And that would usually be Mike Boyster, but he is taking a well-deserved vacation today. So Rob will go ahead and take this portion for us. So I'll pass it off to Rob.
Yeah, I know I'm a poor substitute for Mike, but I thought I would fill in, and maybe Maureen, since she's been attending these meetings as a member of the public, as I have, could also share where I get things wrong or where the additional information would be helpful. So I'm going to share a slide set. Is everyone seeing that? Okay, great. Thanks for the nods. So we wanted to put into context the effort that's being done specifically by the shelter work group to really do the heavy lift to set up a system that can help end street homelessness by November 1st. So the first shot here is just the webpage. I will put the link after I finish talking here in the chat. But this is to the Pierce County website that describes both the comprehensive plan to end homelessness and the work of the shelter work group. Mike Boister is the person who is representing the Tacoma Coalition, Tacoma Pierce County Coalition to End Homelessness. However, we have other folks who are regular attendees and foundational members of the coalition who are involved, including James Pogue from Comprehensive Life Resources, and others who have attended pretty frequently, like Matthew Jorgensen from the city of Tacoma and Melissa Moss. So wanted to make sure that we acknowledge everyone who's participating in the work group. On the website, and again, I will put the link down in the chat when we finish this, there are a number of resources, including information about each of the meetings that are scheduled. The next meeting of the work group takes place on August 5th from 2 to 4. The permanent link to attend the meeting, members of the public can, including other members of the coalition, can attend the meetings that take place on a bi-weekly basis, and also have an opportunity at the end of each meeting to provide public comment. So if you have questions about what gets presented, then you can bring those up during that portion of the meeting. These meetings are also, this is the work that Garrett Nyland has stepped into now, and he starts next week working for Pierce County as the project manager on this work. So big kudos to Garrett. I know we miss him here, but we're grateful to see him putting his skills to work in this effort. So I wanted to highlight also, you can see Garrett's new email address here on the right-hand side of the page. There are a number of things that are available on the county's website, including a high-level homeless system map, a shelter emphasis map that dives into that element of the homeless system, and then a full system map that gets really deep into the weeds. And there are other background materials that are there that if you have an interest in learning more about the effort that's underway, that's a great opportunity as well. But what we wanted to focus on today was to get into the details of the timeline that's been established so far by the work group, and to just stress we've got roughly 13 weeks left before November 1st. And everybody's feeling that pressure. And as it stands now, I thought I would share the timeline that's been shared with the work group and agreed to, so that we understood it, and then we can have a conversation in breakouts after this to help inform the work of the work group going forward. So right now, consultants are working with the work group to do some surveying, additional surveying, beyond what we know Joanne had done. The work group actually received a presentation at its last meeting with the results of Joanne's survey that she presented to the coalition earlier. But they're supposed to, at the August 5th meeting, hear some preliminary survey results, and that survey effort is going to take a little bit more time. So it'll be very preliminary if they do have results at the August 5th meeting. The primary focus in August is going to be to begin community outreach. And I will have a very messy slide that I will show you at the end here before we do breakout discussions that looks at the different organizations that they're thinking of doing community outreach to. And I'm hoping we can add to that. During August, they're also going to be developing the outline for the overall plan, with the goal to publish a final plan in September and begin implementing in October, along with continuing community engagement, ensuring contracts and resources are in place. So it's a heavy lift, and there's a lot of moving pieces to get together in a very short period of time. So as I mentioned, outreach is really a focus that what they said at the last meeting is that they would focus on outreach starting August 9th. So in the week following next week's meeting. So the question that we really have for the coalition that we wanted to consider in breakouts was who should be on the list that the work group and the county should be striving to do outreach to, and who is critical to the success of that outreach and engagement effort. And remembering that it's not just to get information out to the public, it's also to engage and hear concerns and kind of set up a feedback loop as part of the community engagement. So I apologize for the messy slide. These are the folks who I didn't want to do multiple slides, so I just cut and paste from their notes. These are the folks who they already have on the list. And I know it's a lot. It was almost a brainstormed list, the way that they went over it during the last meeting. And I'm sure they're going to dig into it more. So my hope was that we can look at this information. I will cut and paste this into the chat or into the messages as we go into breakout rooms. But look at the list of who's been considered so far and then figure out who's missing, and ultimately have everyone in the breakout rooms taking notes and paste the information in the chat. The hope is that we can help flesh out the list and provide this information to Mike so he can take it back to the next meeting. So before I do that, I am going to briefly stop sharing my screen. And I wanted to ask, do folks have questions before and maybe Maureen has information to add as well. Maureen? And you're muted, Maureen.
Oh, thank you. No, that was a great overview, I think. There are three things I think that I want people to think about as you're considering how we make this happen, how we help make this happen. One is that it appears to me that a lot of the conversations in these committees and in committees like this revolve around what the county or the city already knows from the organizations that they fund. That's where their focus is. That's not bad, all right? It just is. Part of what we have to do, I think, is to make sure that they know everything that's going on, irrespective of who funds it, whether it's even funded or not. Because we've got an enormous system, but oftentimes a given funder only knows the part the funder funds. And so, and we'll talk about that a little bit more later, but so that's one thing, is how we get the entire system reflected. The other is, one of the things that I learned this week in a conversation with the person who chairs the Civil Rights Committee for the National Coalition for the Homeless, it struck me that our entire homeless response system, the way it stands right now, is premised on a soft housing market. You can do housing first when you've got empty apartments and landlords begging for people in them and rent. That is not the market we have had for several years, and it is certainly not the market we have now or going forward. So I think we have to we can't just look at sheltering people by November 1st on an assumption that there is going to be a vacant place for them to move into. We've got to rethink how we're going to define these safe shelter sites, how long people are going to have to live in them, and how we're going to concurrently develop the housing or acquire the housing, because we don't have time to build. We have to acquire. And then the third thing is how the numbers the county's using right now for people who are living unsheltered, whether they're in a shelter or not in a shelter, it's 3,400 a given day. I don't know if that's households or individuals, but there's a point at which it almost doesn't matter because there aren't enough places anyway. But so we're talking about everybody who's living unsheltered being in some kind of safe shelter on the 1st of November. Who are the providers who are going to operate anything that needs to be managed? Even if it's a self-managed site, it's likely to need some sort of a light touch. And so who are the providers? What do we need to grow them between now and the 1st of November? So,
Thank you, Maureen.
It's a perfect world, you know.
Anything can be done. Monique, I see your hand up.
Yeah, Rob, I apologize. I was looking at you, listening to you. I'm confused about the list part. I don't know. Maybe it's I need another cup of coffee. But what is this outreach list about? What kind of outreach is happening, or what? I don't get the list.
So the list is the list of organizations that the work group believes it would be helpful to engage around this effort overall. What they're trying to do is build community support for the overall goal of ending street homelessness by November 1st, and also for community support to actually be able to host sites. I mean, I don't think they're going to be at the point where there's a plan when they're doing this outreach, but they really just want to start building a groundswell of support. And I think that there could be hundreds of things that could be listed on this outreach list. What I presume the work group will do is kind of prioritize where they think they're going to have the, what are the most critical outreach options that they need to make. And I already see some great comments being posted in the chat. So hopefully that puts it in context.
Yes, thank you. Appreciate it.
Yeah, you're welcome. And the one thing I would add to what Maureen said is that during the last meeting, they actually said it was about 3,200 was the number of folks that they thought were currently homeless. But, and to put it into context, that there's roughly 1,000 shelter spaces of various kinds across the county. So the difference between the two is pretty obviously, you know, a couple thousand plus. Maureen, your hand's up.
Yeah, the other thing that I would tell people when you're, if you're watching any of these sessions or you're communicating with Garrett or you're in any of the outreach community engagement opportunities, is make sure what's being presented rings true to you. Because it should, all right? If it doesn't ring true, then either there's information we don't have, and there probably is, or they're going down the wrong path. All right. So it should ring true.
So I think we probably have enough information to go into breakout rooms. So what I'm going to do is I will put us in rooms of 5 to 6 people. We'll spend the next 15 minutes brainstorming additional groups that we think should be on the list, and also use this as an opportunity to get to know each other. If you end up in a room with folks who you don't know or interact with on a regular basis, this is both informational for the work group process and a networking opportunity for those of us who are in the room. It's a poor substitute for when we're actually together physically, but this is what we can do right now. So so I will set up breakout rooms and learn how to talk. All right. And I will repaste into the chat before I send you to the breakout rooms the list of organizations that have already been identified. All right, away we go. Well, hopefully that was a good conversation for everyone. As again a reminder, please paste any notes that you have from your breakout groups into the chat so that you can compile those and get them back to Mike Boisture and help add to the effort for the work group. And with that, I hand everything back to Dwayne.
Thank you, Rob. I appreciate that. That was a real good discussion, and we thank everybody for joining in. All right. And again, please make sure you pass those notes on. We really need them and appreciate them. All right. So with that, let's move to our advocacy updates. We want to learn about the opportunities to impact the policy decisions. So I'll pass it off to Maureen, and she'll update us on that.
All right. Well, good morning, everybody. And Dwayne, if you or somebody would give me a heads up as I approach the time limit, that'll be helpful. So first of all, I sent it out on the listserv, but for I think maybe the very first time, we have placed in the U.S. House of Representatives an unhoused Bill of Rights. And I think Rob's going to stick the link in the chat, but you've also got it on the listserv if you're in the listserv. And my suggestion is that we use that language going forward, which is, I think, pretty amazing and astounding. And it starts with expressing that the United States is obligated to permanently end the unhoused crisis by 2025 and uphold, protect, and enforce the civil and human rights of unhoused individuals, including the human rights to housing, universal health care, livable wages, education, employment opportunities, access to public facilities, free movement in public spaces, privacy, confidentiality, internet access, vote, freedom from harassment by law enforcement, private businesses, property owners, and housed residents, and equal rights to healthcare, legal representation, and social services without discrimination based on housing status. And I think that gives us an amazing framework to use, especially right now, as we're developing the plan and implementing a plan to get everybody off the streets by the 1st of November and into a safe site, and an actual comprehensive plan to end homelessness across our county. So that was a thanks to Rob for flagging that. So I want to talk about a few different things. One is, how do we use this moment? So we've got political will that we've never had before. We've talked about that before. We've got funding that's either in place or coming, the likes of which we've never seen. And so one of the things that I think we need to do, and that we can do individually as well as a coalition, is to reach out to the elected officials or the people who are running, the candidates, people many of you have a relationship with an elected official at one level or another. And so my suggestion is, if this person is leaving office, then ask them what they want to do about homelessness before they leave. What do they want their legacy to be? If they are running for office, ask what they're willing to commit to in specifics. If they're staying in office, then ask what they're going to do with the remainder of this term. And ask each one of them what you individually or what the coalition could do to support what it is they want to have happen. And then report back to me. Email me, send me a text. Don't use a landline for the text, all right? Use the 2200 number or I won't get it. And then it's all on my signature. And then call me, leave a message on either line. And let's see what we get back, okay? The Housing Committee will meet. We're going to probably change the meetings for August because I double booked myself, but I'll confirm that later. I've got a list of small organizations engaged in housing or have indicated they want to be more engaged in housing, or somebody thinks they should be more engaged in housing, either the development, the acquisition, the operation, the program, whatever part it is. If your organization, or if you have one, especially looking for small ones that might not bubble up, please stick those in the chat. You can PM me if you don't want it public, because I'm ready to put together the list for capacity building funding to give the city and the county. There's no commitment on anybody's part to have your organization on the list. If you're a large organization, you're still welcome if it's a specific target that you're trying to meet. I think the other issue that we have to be attentive to going forward is how we adapt to the changes in COVID and the variants, because clearly it's not ending, and we're living with it. So how do we do that? One of the really good things that happened recently was a new relationship with the Centers for Disease Control at a national level. And so they actually have a homelessness unit. They have excellent materials they put out. Their system of communication doesn't get to us at the grassroots. And so we're going to make that happen. And so then I want to talk about a couple of other things in terms of policy issues and things to think about that we'll take on, sort of week by week as they become most important. One is the encampments, clearly. The county just put $1 million into outreach, homelessness outreach. And so I think that we need to understand exactly what this money is buying us and how it's helping people move from the encampments into housing. The figure Garrett gave yesterday in a meeting with the city was 3,400 people who were experiencing homelessness. The issue we have to confront is how much of our resources, one issue, do we want going into the safe shelter, and how much do we want to go into permanent housing? All right. If, say, divide the 3,400 in half, let's just say 2 people share, or it's 2 people per household. I think it's 2.2 or something. And if we said 100,000 per door, and hotel rooms were coming in below that, they were coming in about 75 earlier. But if we just used 100, that's 170 million. It sounds like a lot, but it really isn't, because the county's got 175 million in ARPA money for over 2 years. Just the ARPA state and local relief. The city has 61 million. Every single jurisdiction across Pierce County has some amount of money out of just that pot, In terms of the homelessness system itself, I talked a little bit earlier about, have we in fact created a system that's premised on a soft housing market? And if that's the case, then what do we do now while we have these 2 committees to have a system that works with the housing market that we have? How do we balance emergency need against long-term investments? And how are we going to be serious about prevention going forward so that nobody becomes homeless because we don't have a system that includes an aggressive prevention program? We have it right now because of the rent assistance that's flowing, and we'll have a great deal of that money into the future. But is it incorporated into our system? There are a couple other things I want to talk about as well in terms of policy. And I did this last week, and I think I'm going to keep doing it every week. And that's the coalition itself, okay? Because that's a policy issue for us. So we operated for most of the last 12 months with basically 3 full-time people. We had Kevin for 6 months full-time, and then we had him for 2 more months part-time. Garrett and I have put in full-time work for most of that period. Even when I theoretically cut back to quarter time, it wasn't quarter time. And there are others who are volunteering. So I'm not suggesting that that's everything. But now we're at basically 1 part-time person, me, all right? So the steering committee of the coalition is working aggressively to make recommendations on how the coalition moves forward. Join that committee. That's where the conversations are taking place most intensely. There's a governance committee that Rosemary is, a working group that Rosemary is chairing. There's a separate finance working group. There will be as many work groups as we need, because these are our commitments right now, all right? We believe that we want to maintain these Friday morning meetings, and we want them to be what you want them to be. They don't have to be what they used to be, because the county is running separate meetings for shelters, separate meetings for outreach teams, separate meetings for coordinated entry, and separate meetings for I don't even know what else. All right. And our job is probably to make sure that the unfunded folks get invited to these meetings. We've got 2 grants supporting getting every person experiencing homelessness vaccinated. One of those is about half done. The other one is just beginning. They have incentives for people who are living homeless, and they have a limited amount of money for staffing, and we have to figure out how we're going to do that. We got word that the Lived Experience Coalition did get the county grant, which aligns with our Speakers Bureau. And I have not seen the paperwork yet. I don't know how much money is our piece of it, but I will, and that'll be another responsibility. We've got to be able to maintain the communication structure that keeps us all together. So our listservs, our website, our social media presence, we've got to be able to support the committees that we have. So we've got a steering committee. We've got a Safe Sites for All committee. We've got a brand new Race and Equity committee. It hasn't even met yet. And we've got a housing committee. And those will, right now, though I think Race and Equity is not on the list, on the website yet, but it will be as soon as it's got its first meeting sort of thing. You sign up for those meetings, everybody can come. You don't need anybody's permission from the coalition, all right? You might need an okay from your boss to step aside for an hour, or you could watch the meeting after the fact, because almost everything is recorded. So, and you can get on the listservs that are specific to those topics. So this really is an opportunity to engage in a way that maybe you hadn't thought about before. And they're not lifetime commitments, okay? Some of these are going to be very short term, like finance, all right? It's not where you're going to learn about finance, but if you already know nonprofit finance and have a couple hours to spare, then we want you at that table. I think it's really important we maintain our advocacy role and our understanding of policy. We're recognized, the coalition is recognized. Sometimes we're in actual government ordinances as a stakeholder to be consulted. And it's the press reaches out to us regularly, and so does local government. So I think it's really important that we do that. And then I think we got to talk about how we're going to make decisions, okay? The benign dictatorship period is ending. So I know, but I mean, I promised I wouldn't just call another summit. And I think I've been pretty good about that. I mean, Garrett called the November 1st, get everybody sheltered date. So we'll put that one on him. We don't know, Garrett doesn't know right now exactly what his continuing role with the coalition can be in his new position. We're assuming he'll have a role. We just don't know what it is. So while that gets sorted out, the thing that has always been quietly in the background and sometimes loudly is, how do we make decisions? Now, we don't have to make any decisions. Coalition could go back to being a Friday morning meeting, networking meeting, and that would be fine. If that's what people want, then all you got to figure out is how to keep that network alive. So those are the things that are on my mind. And one of the things that I've done, and I've invited steering committee members, if you join the steering committee, you're welcome to join this ad hoc group that I've asked to basically read an early morning email or whenever I get it out to you about the things that are on my desk at whatever time I start that particular day. So thank you for your trust. Thank you for your commitment. But let's look ahead now. We made it. I mean, as an entity, we survived the worst of the virus. Okay. And, I mean, that's huge. All right. And look where we are. We've got something we never had before. We've got City of Tacoma and Pierce County official commitments to ending street homelessness by the 1st of November and to a comprehensive countywide plan to end homelessness. And the county is staffing that. All right. They've hired Garrett as the project manager. They have hired the TAG group as the facilitator for these 2 committees that are meeting, and Pierce County, through another channel, through the Performance Audit Committee, hired Echo Northwest to do a gap analysis of the entire homelessness system. These are not things we have to do. These are things that we have input into and we can help shape. But they are taking leadership positions, and the city's got its own 5-year homeless strategy it's working on and will be presenting to us in a meeting in August, just kind of where they are. So, feel good about how we got through from the last time that we were able to be in person. And we got through the heat waves, and we'll get through this weekend. And we'll talk about this weekend a little later. But anyways, so thank you.
Thank you, Maureen. We appreciate you. Also, you were only over by a couple of minutes, so you were good, and you were running real well. So I just let you go. I'm sorry. All right. So with that, we will move on to the government updates. And shall we ask, is Clarissa Montoros in the building or in the meeting?
So Dwayne, I had an email from Tegan from the city while we were at the start of today's meeting saying that no one from the city was going to be able to be on the call. But she did provide some update information. So I'm going to do a quick screen share with that and kind of walk through it a little bit. All right. So what she shared was information that will kind of overlap with what we're going to talk about the heat updates later around the cooling center that's opening at Lighthouse Senior Center. That NCS has purchased water for the purpose of using it at the Lighthouse Senior Center. If you're not familiar with where that is, it's at 5016 A Street. And so there's that. She also offered information about the hygiene stations that are still being used under I-705 and at 8th and Yakima. She included information about the weekly information that's posted by the city about the outcomes from temporary and emergency shelters. She also included a link to the rental assistance portal that I'm sure Valerie will talk about shortly, and information about the meeting coming up on August 7th related to the Spark report and phase 3 of that effort, and asking folks if they would like to participate. They're looking for an inclusive team of 5 to 10 members that represent diversity across roles, race, ethnicity, gender identity, and lived experience. And you can email Tegan directly if you have an interest in being part of that group. I will put Tegan's email in the chat. So I will stop the screen share, and that is what I have to share from the city of Tacoma.
Thank you, Rob. Appreciate that. All right. Well, since we've got, Rosemary has something she'd like to add.
I was just wondering, Rob, is that letter something that could be put in the chat? There was a lot of contact information that I couldn't write down. That would be great.
Yeah, I will put that in the chat as well.
Thank you, Rob. Thank you, Rosemary. Is there any other questions before we move on to Pierce County Human Services? Okay. If not, can we have Valerie Knight do a quick update for us, please?
Hi, this is Jeff. I will start the updates and then pass it off to Valerie. I'll provide the updates for the homeless team, and Valerie will provide updates for the rental assistance program. Since we sadly missed her already, it's only been a week, but we severely miss her. Jeff Rogers misses Valerie. I have to tell you, I really, really miss her. Can't say it enough. And I've learned that never mind, I won't say the next part. I can't say that yet. Where do I start? So many things going on. I'm working with outreach teams that we fund and some other folks that have been put in contact with me around the water issue for the weekend, but it sounds like Maureen, we're going to talk about that a little later. Apologize, I just joined a meeting, but I was in a meeting for the last hour from 9 to 10 on the phone with our Public Works Department and the Washington State Department of Commerce regarding encampments along Highway 167 corridor. In case you don't know, Highway 167 will be extended all the way to Highway 509, which is just, what is that, north, or I don't know what direction it is from I-5. So Highway 167 coming off of over on the other side of Fife will go through Fife and extend, and they're starting construction of that road early next year within the 509 to the I-5 corridor area. And as many of you are aware, there are quite a few encampments in that area that we'll need to address, and we're discussing and having those initial conversations now with Washington Department of Transportation, who's committed to working collaboratively with us in our community to ensure that people who are currently in encampments get the best available services to support them. So what I will share today is that, yes, the Washington State Lived Experience Coalition, in partnership with Building Changes, has been awarded funding finally. It's $150,000 for the Lived Experience Coalition to manage and help develop and recruit and provide stipends to persons with lived expertise who should be engaged in all of the work that we do, all the different committees, all the different boards that we support. We need their voice on everything we do. So they just received a contract. It's for an 18-month period, $150,000 to support that work. We also, if you're not aware, we're in the process of awarding money to a provider to assist Pierce County in identifying housing for the persons who are identified and receive a referral for the Tacoma Housing Authority Emergency Housing Voucher Program. That program's kicking off. We yesterday afternoon had the document recording fee advisory group meet and make a decision on those funds. And once those award letters are signed, we're hoping today, we'll put notice out into the community of who's going to get that just over $400,000 award to assist 135 households through Tacoma Housing Authority, identify their permanent housing. They will receive an ongoing subsidy to ensure success and stability within that housing. So that's coming soon, and we should be able to announce next Friday who the successful applicant will be contracted with. We're also, just so everyone's aware, working with the Continuum of Care to get the Pierce County Housing Authority MOU signed for their voucher program. Hopefully, I believe Clarissa would be the one to sign that. Valerie, maybe you could shake your head or yes or no. Okay, and I know Clarissa's not on the call, but she did receive an email late yesterday, so hopefully that'll get signed because the deadline, I believe, is today for that. So that that emergency housing voucher program for both housing authorities is moving along quite well. Still a lot of work going on here at the county regarding the comprehensive plan to end homelessness, as Maureen mentioned, as well as that complementary sheltering plan to have everyone who is unsheltered sheltered by November. There's a lot of work going on. All of you are invited to those meetings that we're having for both the comprehensive plan and the shelter plan. There is a link for guests to come into the room and to listen. And I believe there's also public comment opportunity during those meetings. So please, if you feel you need to share and you want to be heard with what you want to share, I strongly encourage you to participate, come listen in, and when it's public comment time, share what you'd like to share. The other thing that's just consuming my time right now for the last several days is the heat issue we're dealing with. But I'll wait to have that conversation. As Maureen says, we're going to talk about that in a few minutes. So I can't think of anything else because these things we're working on are overwhelming me right now. With Valerie not on the team, we're down a staff person and having staff out on vacation. It's just the time, but we'll get through it. So Valerie, you want to share an update for the rental assistance program?
I think Teresa has a question for you, Jeff.
Oh, sorry, I should pay close attention. I do see your hand, Teresa. Hi, Teresa, what's your question today?
Hi, first, thank you so much for the water work you're doing. It's making a big difference. And several pieces of good news you gave. I do want to respond to the thing of contracting for people to identify housing just by saying, I know that ship has sailed. There's no way to deal with it at this point, but going forward, you got a whole, right here in this room, you've got a lot of people who've been beating the bushes for a long time to find housing that is affordable for people with vouchers and on low incomes. And it would be great if instead of funding people to keep beating the bushes, it would be funding actual acquiring buildings to renovate and house our people. So I get it. And I know that there are probably going to be some people who are helped, but it's frustrating to see we can case manage the hell out of this, but if we don't have housing, there's not much that case management will do.
Yeah, I'm glad you said that because you reminded me of something else I wanted to share today. And because my thoughts are so scattered, you helped me remember. The state released on Wednesday a new procurement opportunity for $40 million to be distributed across the state for the use to lease hotel motel rooms or the whole motel itself, all rooms in a facility for the use of shelter. That also includes funding for the operations of the program, the services of the program, and for folks that are enrolled in those programs to have the opportunity to enter into a rapid rehousing program to transition them out of the shelter into permanent housing. We have to apply by December for these funds. Keep in mind that 40 million is statewide, but hopefully Pierce County will get a decent chunk of those dollars. So we'll be working in the next several months to identify the need, what we're going to do, and how we'll implement that program. So I just want to make sure everyone's aware that there is that opportunity for those funds coming our way. And there will be a lot of other funds coming our way with the unsheltered plan we're developing. I will share that there is conversation going on about the acquisition of hotel motels in Pierce County to be used for shelter short-term for a few years. And then after that short-term period of being utilized for shelter, converting them to permanent supportive housing for chronically homeless to reside in permanently. So there's a lot of work on that front going on through this unsheltered work going on as part of all the different puzzle pieces of work we're working on. So thank you for me to remember to say that.
It's all good news, but the most hopeful and long-term thing that you're talking about is the thing you talked about last. Please pour whatever you can into that last one. And if you can steal it from the other places you have money, please do. That's where we need it. Thank you. That's a great plan.
Yeah, I'll just say real quickly, sorry if I'm going over time. Our HHP NOFA, which is our largest funding opportunity we put out annually, priority is permanent supportive housing. So if anyone's interested in permanent supportive housing, it's been our highest priority for years. We tend to not get people to apply for it. I think there's a challenge with the capacity of agencies to develop these types of programs, but that is a high priority for Pierce County. The development of PSH is one of the highest priorities we have. Valerie, sorry.
That's okay. And I'll add 2 things to Jeff's very long list of things they're working on. Continuum of care funding we know is going to open soon, and it does have a priority of PSH also. And every year we beg people to apply for funding because new projects are the only way to increase our rate. So please, please, please look for that when it comes out. And then second, Jeff, we didn't celebrate. YHDP was submitted on Friday. So the Youth Homelessness Demonstration Grant was submitted on Friday, a few days early, which is like aligning stars, right? Like that's insane. So, so those 2 things go to Jeff's credit as well. But so rental assistance, I'll be as fast as I can because I see your time. Our RFP, request for proposals, is open now, and that is for a new portal that will be coming online. So there's about 4 weeks to apply. It is through our website. I'll get the link and put it in the chat. But that is to create a new portal for us to go through, which is a 4-year program now at least. So that's good news. We have a notice of funding availability out for up to $100 million for rental assistance that will start January 1, maybe sooner because we're spending money a little faster than most communities. And it will go through 2025. So that notice of funding availability is open. It's not due until the middle of August because we gave 4 weeks to reply. So those are both going now. And then for rental assistance update, just so you all are aware, for our Department of Treasury dollars, we're at 48.11% spent. We're only supposed to be at 43, so we're ahead of the game. And then for our Department of for our TRAP dollars, which is the state money, we're at 49.5% spent. We have 3 agencies that have actually spent so quickly. We went back to the state and said, do you have more money? And they said yes. So we have requested about $10 million more dollars on top of all the other dollars we're getting because that's just how it's going to work. So we're processing that now. We're processing our first run of the American Rescue Plan funds now as well. So that's 19 million more to add to the 58 million, not to include the other dollars that are coming. And so as soon as those get contracted out, more referrals will go out. We have about 4,300 households waiting. So what we have done is implemented a twice a month email that goes out to all the tenants and all the landlords, letting them know they're in the process, they're pending. Very, very popular word right now, because as long as you're pending, you cannot be evicted. So they are pending processing. And so we are sending those out twice a month just to make sure landlords are calm, know we're working through it, don't evict, don't move out of your unit, just hang tight, the money's coming. So just lots of kudos to the 9 providers. They are just kicking butt and taking names. So we're just going to keep moving forward and rushing as much as we can to get these rental assistance out the doors and to prevent as many evictions as possible. So the other 2 updates I'll give is we work very closely, as you know, with City of Tacoma, making sure they can spend their dollars down. They go through the portal. We have also been contacted by Bonnie Lake. We are going to issue and support them some way to get their dollars spent. And the City of Lakewood has also reached out to us. So we have started referring people to the City of Lakewood who live in Lakewood. They can receive their assistance first and then still receive ours. So very collaborative effort, very community-wide response, and we are looking to grow that. So if you know anyone who is interested in being a rental assistance provider, I encourage you to apply. So that's all I got. It's my first full week on the new job. It's very weird.
Thank you, Valerie, and congratulations on the new job.
Thank you. I see 1 hand up.
I think your work has been amazing. And I mean, I don't even follow it because, well, really, I haven't.
Compliment.
Well, it is, and I'm on these calls that are supposed to be about something else, and they're all about places where 1% of the money's out, or nobody has access, or, that sort of thing. And I'm like, oh my God, we could be the only county in the country where this is actually working,
Yeah. We are learning, and every community has something to share. And so we listen to all of those same experiences and we're like, hey, that's a good one. Let's talk to the housing authorities. Let's talk to this entity. Let's talk to that entity. And so we will continue to grow and improve. And by the end of this, we may have like the best thing ever, right? But the goal is to make as many landlords whole as possible and make as many tenants housed as we can get. So we'll just keep pushing forward until we succeed and make amends as we need to go. So thank you.
Good deal. Thank you. All right, we are getting short on time, so I want to make sure that we have a chance to speak with Rihanna Battencourt if she's on.
I don't know if she is here today. This is Adam Reichenberger, the Housing Policy Coordinator at the Health Department. I haven't seen her pop up today. I also, so I guess the biggest update with her, I think we're going to be transitioning her out of the role, and I've already been participating in these meetings and with Maureen in the housing group, and I think I will also be sometime shortly be providing these updates as well. But that is, unfortunately, this week's a little bit of a gray area. So that transition's happening, and you'll get more of me.
We'll appreciate your presence here. And thank you for letting us know what's going on, Adam. All right. So with that, let's go ahead and move to Ivan. Are you on the call today? With the Pierce County Emergency Management, do we have anybody from here? Nope. Okay. All right then. So with that, if there's no more government updates, we'll go ahead and move to safe sites.
No, heat.
Oh, heat. Yes, heat and weather updates for the weekend. I am sorry.
Okay, heat. Call Jeff Rogers. So I notice he doesn't have his face showing. When he's done grimacing, he'll maybe come on. All right, so here's where we are. And no, but I'm serious, folks. This has like been a world of difference. Okay, Stability Site is open. Take what you need, and be prepared to tell someone after the fact how much water went out to the county sites, how much stayed within city sites. But the city is doing the resupplying of the Stability Site. All right. As far as the coordination of the outreach workers and the participation in the Pierce County Department of Emergency Management and Pierce County Human Services engagement, all of that really is Jeff Rogers, for which I am beyond grateful. And I have given Jeff the information that I have for those of you who are not funded by Pierce County to do outreach. So, and you were all copied on that email. Please reach out to him if you have not done so he can run his own list and stay in communication with you. He's not going to tell you where to go, but the more information you can give him about what you're seeing or what you're doing, the better he can have a comprehensive view of what's going on. There may be more cooling centers. Shiloh is discussing it. I haven't seen anything yet this morning. And there could be others out there. That's what happened last time. Faith-based organizations within the city of Tacoma do not require any kind of permit or authorization or anything to open a cooling center. They simply make a decision and they open it. The Pierce Transit, the bus rides are free for people going to cooling centers. You just tell the bus driver that you're going to a cooling center. I know it's not perfect, okay? But it is more than nothing. There will be a formal Pierce County Department of Emergency Management convened after action report on the June heat emergency on August 11th. Jan Runbeck, Monique Brown, and I will represent the coalition. We'll take forward everything that we have already received from you about our learnings and try to be attentive. And the language that I've seen most recently from that entity, the Pierce County Department of Emergency Management, calls out the needs of our most vulnerable people, those who are unsheltered. And it may be we come out of this with something that becomes actually a language model and process model for a lot of other places. We do also have all I know about this is that the city of Tacoma invited me to represent the coalition and, excuse me, in their acknowledgement of all of the volunteers engaged in the response to the heat waves in the Compassionate Tacoma recognition, which will be August 10th. I'll know more about that later today after a meeting and can advise people. So that's what I know about heat. So Jeffrey, my new best friend, Jeff Rogers. Monique.
Thank you. I just wanted to state to everyone on the call, I know that there's sometimes overlap. I'll show up somewhere and there's water there. So if you know of an encampment that you're like, nobody's coming to this encampment to give water, please let me know so I can drop water there, because I really don't have a good clue of where to go. I'm just kind of driving around. So if you know of a place that is not getting water, drop it in the chat, email me. I'll put my email in the chat. I'm picking up at 11:30 this morning, and so I can run some water out. Cool. Thank you.
Thank you, Monique.
All right, Jeff, take it away. Oh God, maybe I chased him off.
No, you didn't chase me off, but what am I taking away?
Anything you want to add to what I've just said?
No, I think you basically said all of it. You did a very good job of explaining all of that and sharing all of that.
Well, thank you. People, I'm serious. Email Jeff. You've all got his email. If you're not funded as an outreach team by Pierce County, let him know who you are. And if you're going out, where you're going.
So email me, Monique.
Yeah, Jeff, stick your email in the chat again for folks.
Jeff, what am I emailing you for?
So he can find you, so you can talk together.
Yeah. Okay. Gotcha.
Yeah.
It's a beautiful thing, networking in real time. Thank you, Jeff. Thank you, Maureen. Thank you, Monique. All righty. So with that, is there anything else that we wanted to talk about as far as the heat? Or,
Janet has her hand up.
Okay, thank you. Janet?
Jeff, do you have plenty of water?
There's water available, and our outreach teams that we're working with have been informed that if they need additional water, that they have the authority to purchase water, and that we will reimburse them for that water. They can use their contracts, and for something with the challenge within their contracts, we could have a conversation about amending their contracts later.
They can, Jan, they can all go to the stability site.
Yeah.
Everybody can go to the stability site who is taking water out to encampments. And if they purchase water to be used within the city of Tacoma, if they purchase garbage bags or medical supplies within the city of Tacoma, the city will reimburse them. If they cannot do the direct reimbursement with the city, the coalition will do it with AM with the city. So there's a process for reimbursement.
And as well with our providers that the county contracts with doing outreach.
So again, it's not perfect, but folks, this is like, I mean, I'm not up in the middle of the night wondering if somebody's going to die because we don't have water. The city is monitoring the stability site. The city will replenish the stability site. They already did once. So, yeah. And thanks to CCS, if you're still on, for the folks at the stability site who simply added this again to their everyday duties.
All right. Thank you very much. Appreciate you guys. Thank you, Maureen and Jeff, and thank you for bringing me back to my orientation, Maureen. All right. So let's move to safe sites. Do we have Colin or Janet on the soft call?
If Colin is not here, I do know that we have spots open. So there are business cards being printed so folks can put business cards underneath windshield wipers. If you suspect somebody is sleeping in their car, to connect that person in the car with a safe site potential location. And there are spots available throughout the city and the county. So please utilize this asset that this coalition has developed.
Thank you very much, Janet. We appreciate that. Anything else for the safe sites this week from anyone else, or any questions? And I can't see your hand, so please unmute and just go ahead. All righty. For the sake of time, we shall move on then. All right. Can we have the coalition committee updates, please?
And I placed this on the agenda just so that we could make sure that we covered any committee meetings that took place this week or advertise upcoming committee meetings. So I see Rosemary's hand up and I was hoping she'd have something to share.
Hey, I was wondering about our steering committee decision about the donate button, if that'd be appropriate to mention now. So the steering committee this past week, we looked at the money that we received during the past heat emergency when people offered to help and they didn't know how, and we created a donate button on the homepage. And I don't know the total funds, but it's something around $800. And so we had said that with that money, we would support people who are living homeless in their need. And that wasn't very specific, but we learned yesterday, on Wednesday, that garbage bags are the gold standard for things that are needed on the street. And so we decided that we would deputize Jeffrey as our person to coordinate with any others who are interested in this to provide both cleaning and garbage supplies to encampments. And so that money was donated up through July 31st, so up through the end of this week, and will be earmarked for those services, and Jeffrey will be reimbursed if he's the one making the purchases, or will use the same process Maureen described earlier. So if you're interested, contact Jeffrey for any assistance with that. And any monies going forward, we still need to have a process for how we would spend monies donated to the coalition. As Maureen stated earlier, we're still a very informal group, but we have a finance work group that doesn't have a meeting date yet set. But if you're a person with some experience or interest in developing financial policies, I'm going to put my email in the chat and I'll make sure you get on a mailing list that's for any meetings that we are setting up in the near future. Additionally, I have agreed to coordinate the governance work group, which has a task to create in the next few days of helping to deal with the grant monies that we have and the carrying out of the grants and policies or processes for ensuring that we have a staff person, that we are managing any of the funds in the ways that are appropriate. And so if you're a person with some background in personnel management or grant management and want to contribute a couple of hours to creating some of those things, then also contact me. And then the third group we actually did convene this past week is the Race and Equity Committee. We had a small group who had agreed earlier that they were interested. So we met just for an initial meeting, and we will be meeting this coming week, August 5th at 3 o'clock with a primary task to look at a survey we'd like to create to find out who we all are in terms of our backgrounds. So we know what kinds of plans and programs and tools we might want to use as we try to ensure that we lead with racial equity and inclusion. Those, I think, again, if you just let me know if you're interested, I'll provide information to you for any of those groups. And I'll put my name in the chat. And I think Monique wanted to say something.
Yes, and I don't want to offend anyone. I'm a military veteran, Army specifically, so I say things very bluntly and upfront. But if you have complaints about any of the things that we're talking about, show up to these meetings. If you are passionate about diversity, equity, inclusion, then show up. You can't complain about it and then not show up to make a difference. So just putting that charge out there. Come show up and help us out.
And that was greatness. I appreciate that, Monique.
So I would just add, thank you, Monique, very much for that encouragement to participate, that the governance work group is focused in the next week on this grant, managing these grants and the staffing related to it. But our overall charge is really to develop alternatives for how we want to be as a coalition. So if you're interested in that kind of thinking, then that's another reason to join up with us to have the conversation and help create the process. I don't know if anybody has any questions, but that's what I know for now.
Thank you, Rosemary. Much appreciated. Alrighty. Any other updates for the coalition? I see.
We have We have an update on signs. Teresa has signs, I have signs. They're specifically to promote the ending homelessness by 11/1/21. And the more we get out there, the more we can do that kind of outreach and start talking and showing people what needs to happen, start some conversations. So I have them, Teresa has them. I'm here at work, 621 Tacoma Avenue South. I'm here basically every day, 9 to 4. You can come pick one up from me anytime. Teresa has them on her porch, and we're ready to go. We're taking donations. The signs we were able to do them because of generosity of a lot of people in this coalition, and we really appreciate it. So if you donated to make these, we've got one for you. If you want to donate when you pick one up, great. We have several different ways you can do that. That just allows us to make more stuff, get the words out there. Teresa, did you have more details? Or
I'm going to send out an email later today with some times that I will just know that I'm here, and if you want to drop by, you can. It's harder to make appointments than to just do some blocks of time. So that, please look for it in your inbox. It'll just say signs available between this time and that time.
All right, thank you guys very much. Appreciate that. Any other questions or issues that we'd like to add? No. Okay. All right. With that, we shall move to the Pierce County Homeless or short website tour that's going to be given to us by Rob. So I'll hand it back over to Rob. Thank you.
And in the interest of time, I will definitely make this just a few minutes, but I wanted to share for those who maybe are new and haven't ever visited the website at pchomeless.org, wanted to just kind of point out a few things that are useful there. So even though he's been on cooking duty, Garrett has made some updates to the website. You can see that as of yesterday morning, he did an update about the cooling stations that are open across the county. So this page, the main page, changes pretty frequently. It has the links to all of the meetings that we hold, including the steering committee meeting, the governance committee meetings, as those come up. As Maureen mentioned, as Garrett has to step back, it's likely that it will fall to others of us on the coalition to keep the page updated. I'm hoping to get a kind of tutorial from Garrett on how I can do that so that we can keep the most up-to-date information there. And the one thing I wanted to show, a lot of people ask about joining the listserv. It is this link right up here along the top that shows all of the different listservs that are available that you can subscribe to, not just the main coalition list, but also the steering committee list, Safe Sites for All list. Encampment alerts is another option there. And if you do find that the coalition listserv, the regular feed of email is too overwhelming for you, you can subscribe to the daily digest. The other thing that I will share is that I know Jan asked earlier in today's meeting about where can we find video of the past meetings. So if you see under recent presentations here, there's some wording that describes what each of these meetings includes. When you click on that, it actually brings you to a page that allows you to listen to the entire content of the meeting. You can also go in and watch the presentation if you wish. You can see the chat, which ends up looking like this. And you can see the full transcript that is done automatically by the Otter AI transcripts. So that's all I will do for today's update, but we will periodically revisit the website. We want to make sure that people are aware of the resources that exist on the site, and that people use it as a place to turn for information, because literally it has information about coordinated entry, about overnight shelter, about showers and day centers. It's meant to be an information hub. And if you're working with a client and need to refer someone, this can be a real resource. And I turn it back to you, Dwayne.
Thank you, Rob. Appreciate that. All righty. So at this point in time, we will go with the good of the order. The purpose of this is for announcements for the good of the order for all. Do we have anything we'd like to add? Jeffrey?
I am a member of I chair our bishop's homeless task force. We've spent 2 years looking over and researching best practices across the country. The website is now put together, complete, and I would welcome everyone to review it as needed. We have really worked hard to find the best practices that are being used across the country. And there's a lot of good articles in there too. I did put it in the chat. It's sun-ww.org. And I highly encourage everyone to at least review it and see if there's maybe some new ideas for us. Thank you.
Thank you, Jeffrey. Appreciate the information. Wanted to point out that in the chat, Sheila let everybody know that Goodwill is partnering with Tacoma Pierce County Health Department for a back-to-school resource fair on the East Side at the East Side Family Resource Center. The address is in the chat, so please look at that if you have any families in need. Anything else that we'd like to add for the good of the order? And again, please unmute and just come in.
I have my hand raised. This is Julian. Can you hear me?
Yes. Thank you.
That's too bad. I, Julian Wheeler, chair of the Pierce County Accessible Communities Advisory Committee. Just want to put out our announcement for our Tuesday, September 14 regular session meeting, and it's going to be on Zoom. So thank you for having these meetings on Zoom. Zoom at 9 a.m. So we're looking for new members, new ideas, and we help expedite funds for accessibility projects in Pierce County. And these funds come from traffic tickets, not traffic tickets, parking tickets, if people illegally park in disability spots. So if you want to do that, go ahead and they'll help fund the project. But I hope to see people there. And let's make Pierce County accessible for everyone. Thank you.
Thank you, Julia. That is a very important point, and we appreciate you sharing today. And sorry, I didn't catch your hand. Who else do we have? And please unmute because I am missing hands, obviously.
Good morning, everyone. This is Dion Lister with Career Team. And like I talked about today in our breakout meeting, for Career Team, we just wanted to kind of be here today, kind of be a fly on the wall, kind of take things in, see what type of resources you guys are providing, and figure out if there's any type of way we can kind of leverage in what we're doing to help individuals that, although they may be experiencing homelessness, they may be ready to kind of get their foot back in the door in the workforce. All right, I know there's a lot of barriers that take place that kind of makes it a bit difficult, but there are probably some people that are looking to get back to work, and we can help provide a lot of different services, all geared towards getting back to employment. You know, resume assistance, interviewing assistance. We can help provide training for certificates and different things like that. And just all the wraparound services that come with getting individuals back to work. So I just wanted to highlight that, let you know that we're here as a partner and a resource to kind of help leverage, you know, just resources together to help as many people as possible. And if I can leave some information with one of you all, that way it can be kind of saturated throughout the different organizations or whatnot, just let me know.
Yes, thank you, Dion. And if you could add your information to the chat, that'd be great. Also, as Rob was saying, you can go to the coalition meeting website and add yourself to the listserv there also.
Perfect. Thank you.
Monique.
Hey, Dion, question for you.
Yes, ma'am.
I know that a lot of the folks that I do outreach to, if they want to get back to work, it's like quick stuff, not a whole lot of time to do training and all that kind of stuff. You said something about certificates. Are you talking like assistance with flagging and things that they can get back into work fast, or?
Absolutely. We did a few different cohorts with TRM last year where we took in a number of individuals who were interested in the program. And what we did is we brought them in, we got them all trained up on their forklift, which that's a one-day training, right? And so we were able to help them get that certification, pay for the training, get the certification, and we were also able to present them to employers who needed warehouse workers with forklifts certification. So quick turnaround stuff. We also have some of the longer term stuff, but like I said, we try to meet people where they are, right, and try to do as much as we can for them, based on their situation. So.
Thank you very much, Dion, for the information. Appreciate it. I thought I saw another hand, or yes, Teresa.
I just wanted to say to Dion and any other organization who would be interested in doing a 5-minute spotlight during this meeting, I'm putting my email address in the chat. Contact me and we'll schedule it so that we get to hear about these sometimes unknown organizations to us.
Appreciate it. Thank you.
Thank you for that, Teresa. And thank you again, Dion. We appreciate you being here and hope to see you in future meetings. All right. With that, we are running with close on that time. So what we're going to do is move to reflecting on today's meeting. Are there any things that people would like to bring out about today's meeting that hit them a certain way? What worked? What didn't work? Or what should we do different next time? Any suggestions? And again, I can't see hands. I'm sorry. I can see certain people, but I can't see all of them. So if you just want to unmute, that'd be great.
I'll just say again that I love the process. I'm actually going to steal your format for some of my meetings because I like the process and the way it goes. It makes the meeting flow so well. So that's my input.
Thank you, Mr. Huff. You're doing a great job with that. Thank you. We appreciate you. It does go very well. Even somebody like me can run the meeting. Okay. So
actually, that's something we're looking for, Dwayne. Yeah. Is that we're looking for people who would like to facilitate, if not the entire meeting, half of the meeting, say. It breaks nicely into 2 1-hour segments. So let Rob Huff know if this is something you'd like to do. And you don't have to do it for your life.
And it's not required that you have a wonderful voice like Dwayne does and a nice manner like Dwayne does, but it would be helpful if you had some of those qualities.
I appreciate that, but I believe everybody can do the same thing if they just going to go ahead and try. So if at any point in time you feel brave or you just want to try it out and it's either clunky at first or it's smooth at first, it's still something that we'd appreciate. So please jump in. Thank you.
Dwayne, I don't know if you can see the chat. Adam has some updates from Rihanna from the health department.
Oh, I'm sorry, I missed that. Go ahead, Adam. Thank you, Marie.
Trying so hard. Sorry, my phone died earlier and I was getting emails from Rihanna at the same time. So I just dropped a couple links in the chat. One is our COVID-19 community outreach toolkit that I encourage folks to check out and share widely with their networks. A lot of good resources there. And then I think Rihanna shared this in the listserv yesterday, but links to our Keeping Cool website for tips for the upcoming heat. So those are both in the chat now. Thank you.
And Dwayne, you're muted right now.
Oh, and that makes things a lot harder for you to hear me. Sorry, Rob.
No problem.
And I was saying thank you, Adam. I appreciate you passing that off to us. Are there any other updates that we'd like to add before we release you guys for a wonderful, amazing weekend?
Rosemary.
Go ahead, Rosemary. And the mute thing is still happening because you're muted, Rosemary.
Anyway, sorry. Gail had put in the chat that she'd lost the chat and asked for someone to send it to her. And I was just thinking, Rob, you could reinforce what you said about that and help all of us to understand how to save the chat ourselves, but also how to retrieve it.
Yeah, sure. Very briefly, I can only describe what I see on the screen, but there at the bottom of the chat screen, I see 3 dots that allow me to, when I click on it, it says save chat. That's one way that you can save the chat yourself. I actually just used that feature to save the chat text and drop it into the chat as a file. So Gail, that should be helpful for you. You can just grab that and download it from chat.
She lost it, I think, lost her computer access. So she wanted to get someone to send it to her. And she can find it, I think, on the web page, as you were saying earlier.
Right. The only challenge with the web page is that it does take a little bit of, there's a little bit of a time lag. So it doesn't get posted immediately after the meeting, but we're working on that. So that's one of the things we're working on there. And thank you, Sheila. I see that you sent the file to Gail. Teamwork.
Yep. A lot of hands make for light work. So thank you guys for being here with us and helping out. And I see Janet, did you raise your hand or was that just a wave? No, okay. Go ahead, Rob.
Yeah, so what I will say before everybody takes off is that we will have a planning session for next week's meeting and upcoming meetings immediately after this. So if you do have an interest in participating in that, after we take a little 5-minute break, we will continue in the same room. So that's an option for you.
And with that, we say thank you guys all for joining us today. And again, those of you who would like to hang out, please do so. Enjoy your weekend.
Thank you. Oops.
Go ahead.
Thank you, Dwayne. Thanks, Rob.
Thank you, guys. Have a great one.